The broadcast is now starting. All attendees are in listen-only mode.
Hello, everyone. Thank you for joining us today for our webinar entitled 2022 MIPS Participation Highlights and Important Updates. Today's presenter is Bruce Mackey, Alterum's Regulatory and Incentive Program Analyst. My name is Liz Jones, and I am today's moderator. Before we begin, I have a few housekeeping items to touch on. A PDF copy of today's slides can be downloaded right now from your GoToWebinar interface. We will be keeping everyone muted during today's presentation. If you have a question, please type it into the questions box in your GoToWebinar interface, and we will address it during the Q&A. Because of the large number of attendees for today's webinar, we may not have time to answer all of the questions. If we do not address yours during today's broadcast, you will receive an answer through email. Also, a link to the recording of this presentation will be available soon on the events page of our website at www.qppresourcecenter.org/events. Today, Bruce will review the 2022 participation rules of the Quality Payment Program, providing general program education, as well as reviewing the notable changes in this sixth performance year. He will discuss the addition of new clinicians for this program year, the 2022 performance thresholds, updated category weights, and how reweighting performance categories affects your MIPS final score, and 2022 updates across the 4 MIPS performance categories. He will also discuss the unfortunate end of CMS-funded program assistance and how you can stay connected to Alterum through some of our other ongoing quality improvement programs. Following the presentation, with any time remaining, Bruce will answer any questions posed by the attendees. Please note, the information you will hear in this broadcast is current as of today and is only intended to be a general summary. With that, I will turn things over to Bruce.
Thank you, Liz, and thank you, everybody, for joining us today to go through the 2022 MIPS or QPP rules and all of the different changes and whatnot. There's not a major overhaul this year. That is probably coming next year with the MIPS value pathways, but there are a number of different updates and changes that you need to be aware of this year to make sure that you remain successful in the program. So with that, let's dive right in. So we're here, of course, talking about the Quality Payment Program. Really, we've got these 2 tracks of participation: the MIPS track, the Merit-Based Incentive Payment System, and the Advanced APM track. The vast majority of the changes, and thus the focus of today's discussion, is really just on the MIPS track of this program and all of the changes reflected here for this new year. There are a couple of nuggets kind of sprinkled throughout that do affect the Advanced APM track. So you will see those, but 99% of what we're going through today just really focuses on the MIPS track of the program. So one of the questions I know everybody has is how will CMS address the ongoing COVID-19 pandemic in this new performance year in 2022? As of today, anyway, CMS has not announced any changes that they're intending to make due to the ongoing pandemic. I am certain they are keeping very close tabs on things and trying to make that determination. I suspect they would very much like to not give a free pass this year if they don't need to, but I think it's probably likely, possibly likely, that they're going to extend kind of the same fluctuations or options that they've provided to you all in the past couple of years to this year as well. But as of today, they have not made any of those changes. So at this point, you really need to assume that there will be no free pass on 2022 MIPS reporting due to the pandemic. That way, you won't be caught between a rock and a hard place if you're going to assume that or hope that there's going to be that free pass later on via a new announcement, and then perhaps there isn't going to be. So as of today, I would urge you all to assume there is not going to be an extreme and uncontrollable circumstances policy that once again recognizes COVID-19, but I think it's certainly possible. So how will you know if and when that does happen and CMS does recognize COVID-19 as an acceptable reason for an EUC application again this year? A couple of different ways. I would urge you all, for this reason, as well as many others, this program changes on a regular basis each year. Subscribe to the CMS QPP listserv for those announcements. So go to the main QPP website at qpp.cms.gov, scroll all the way to the bottom, and in the kind of the footer at the bottom of the web page, you will see an option there to subscribe to their listserv if you are not already subscribed. They will certainly push out any program changes, whether it's regarding COVID-19 or anything else through that listserv, as they always do. And when and if they do make updates due to COVID-19, they will also update the COVID-19 response fact sheet as they've done each year. And I've got links there at the bottom on this slide as well. Okay, so one of the changes we have coming at us this year is we finally have some new eligible clinician types. We haven't seen changes for a number of years on this, meaning the types of clinicians who are mandated to participate in the MIPS program. We now this year do finally have two more EC types, or eligible clinician types, being added. We have clinical social workers and certified nurse midwives. So those folks will now be assessed against that low volume threshold. And if they exceed that low volume threshold, which did not change at all this year, by the way, then they might find that their participation is mandatory in this program. They did create quality specialty measure sets for both of these new clinician types, these new EC types, and they have added automatic reweighting of the promoting interoperability category to 0% just for the clinical social workers. So they did not include certified nurse midwives in that automatic reweighting. So as you might recall, the vast majority of these EC types that are on your screen right now automatically get reweighted in the PI category. So that's everybody on your screen now, with exception to the physicians, the osteopaths, and certified nurse midwives. Everybody else gets that automatic reweighting of the PI category. But for some reason, they opted to only extend that to the clinical social workers and not the certified nurse midwives being added this year. So as expected, we saw a significant jump in our performance thresholds. I've been kind of warning everybody for the past few years about this. There was a statutory requirement that for this program year 6 of the program, the performance threshold, which CMS up to this point has been able to just arbitrarily set whatever number they wanted. As of this year, the original macro legislation that gave us the QPP required CMS to set the performance thresholds based on the mean or median of a prior program year. The regulation also stated that exceptional performance threshold must be the 25th percentile of possible or actual scores above that performance threshold from a prior year, and that this year is the final year for additional performance threshold for that exceptional performance. We will not have that as of next year, but we still have it this year. So as I suspected they would, they finalized all of the new performance thresholds based off 2017 data, which was the first year of the program. So the scoring floor, which means that minimum score that you're going to have to achieve to avoid being assessed the maximum 9% penalty, last year was 15 points. This year it increases a little bit to 18.75 points. So anyone scoring below 18.75 points will automatically be assessed the full 9% penalty. Make sure that's not you. The performance threshold, meaning the score you need to get to avoid any penalty at all, has a significant jump from 60 points last year all the way to 75 points this year. And if you remember, early on in the program, 75 points used to be considered exceptional performance. And now it is that just mean performance, that minimum performance that you need to achieve to avoid a penalty. And then that exceptional performance bonus, those extra rewards that goes above and beyond the regular rewards, jumps from 85 points to 89 points. And again, this is the final year that we're going to have that exceptional performance threshold and those extra rewards. So another thing that the original macro legislation dictated was that as of this year, the cost and quality categories had to be equally weighted at 30% each. So we did see those changes as we expected for this final, or for the 6th year of the program. Now that we're transitioning out of those, the initial kind of onboarding years, quality now is worth 30%, cost is worth 30%. Improvement activities is still worth 15%, as we've seen for a number of years, and the PI category is still worth 25%, which we've also had for several years. So I believe this will be the last change in those performance category weights. So as long as we're still working in the traditional MIPS realm, as we are still this year, these will be the category weights moving forward. They did not make any changes to the MIPS APM or the APM performance pathway weighting from last year. Some other updates. One thing they have done that they've extended still into this year for COVID-19 is the complex patient bonus. They started doubling that last year due to COVID-19. They are continuing that doubling, so you can earn a max of 10 additional points to your MIPS final score, depending on the number and complexity of those patients that you have in your patient panel. They did make a little change to the facility-based measurement. In prior years, they used the combined quality and cost scores to determine whether it was more advantageous to use facility-based measurement for a clinician or group, or to use their own practice level data for their MIPS final score. Now they have changed that, where they are now looking at the MIPS final score. So they will calculate a MIPS final score using the facility-based measurement calculations. They will also calculate a MIPS final score based on the clinician's practice level data if they submit that, and whichever MIPS final score is better is the one that they will use to award the clinician or group. They made some updates to the public reporting through Care Compare. There is some call outs to facilities that clinicians are affiliated with. They've also delayed some of the reporting for some new PI measures and improvement activities. I have a link there to the Care Compare website. Again, if you did not know, QPP data or MIPS performance data is being populated to the Care Compare website. That site is there for patients to be able to shop around for clinicians that are demonstrating high quality and low cost. They have also made an improvement to the identification of payee tax IDs for the QP bonus. This is one of those little nuggets that affects the other participation path of the program, the advanced APM path, when clinicians that are in those advanced APMs earn that 5% QP bonus. Because there's a 2-year lag between the performance year and the payment year for that bonus, some clinicians are hard to find when it comes time to award them their bonus. Because again, those bonuses get paid out to the tax ID that the clinician is working at. And if they change tax IDs, if they start billing under another tax ID, CMS will look for that clinician where they're practicing today and send that 5% lump sum bonus to the new TIN. So they have improved that identification process so that making it a little easier, they'll be a little more successful in finding those clinicians that have moved to other organizations between the performance year when they earned that QP status and the payment year 2 years later. They have also laid out plans to transition to fully digital quality measures by 2025. There's a lot of hoops that have to be jumped through to stay on track with that, but just know that if you are still reporting your quality data through the claims process, there is a really good chance that you only have a few years left to be able to do that, that you are going to need to transition to reporting on all digital quality measures, meaning claims-based reporting is likely to go away in a few years. Performance category reweighting. They have, this is a nice change. In prior years, small practices who did not want to report promoting interoperability data had to apply for that PI reweighting, that is no longer needed. So now small practices are moved into that class or those special circumstances which allow CMS to automatically reweight PI. So for those small practices that will be looking to take that small pass or that pass this year on PI reporting, you don't have to put in an application for that anymore. So as of this year, if you are a small practice, meaning you have 15 or fewer Medicare billing clinicians in your TIN, CMS is automatically going to reweight the PI category for you. You do not have to apply for it. That said, you can still participate in the PI category. Just submit the PI data and CMS will automatically score that data appropriately, and it wipes out that automatic reweighting. And then depending on which categories are left, there's a lot of circumstances there that might create some reweighting opportunities. The grid here would tell you, how the reweighting shifts across the remaining categories if you choose to take a pass on any of them. All right, let's roll into the MIPS performance categories and the different changes. We'll start off with the quality category. We've got 200 total quality measures available for this year. They did make substantive changes to 87 of them. So almost half of them saw some changes. I call that out because these changes can have significant effects on your workflow and the measurement and whatnot. So make sure that you are looking at, if you are intending to reuse last year's quality measures, don't assume that everything is the same as last year. There's a darn good chance that some changes have been made to the quality measures you've been reporting on, and you need to understand those changes to see if there's any workflow changes or calculation changes that are going to be made to those measures this year. 9 of those changes are so significant that CMS is not going to be able to use the regular historical benchmark to score you this year on them. That might mean you want to look at using some other quality measures this year. So grab the historical benchmark file for this year. There's a link on your slide now. So if you haven't already, I would urge you to go into the handout section of your GoToWebinar interface and download a copy of these slides so you can access the different hyperlinks. That hyperlink will download this year's quality measure benchmark file. You can look in that and see if the measures you are intending to report on have historical benchmarks that they can use again this year or not. They also removed 13 measures, another reason to make sure that if you're intending to use last year's measures again, make sure that they're all still valid. And they also added 4 new measures, including 1 new administrative claims measure. And on the next slide, I'm going to tell you why you might want to take a look at those 4 new measures as well. There's some scoring flexibilities that you might be able to take advantage of that I'll touch on the next slide. They maintained the data completeness threshold. They had proposed to increase that to 80% for this year. They have decided to maintain the data completeness threshold at 70%, not only for this year, but also for next year, for 2023 as well. This next change I don't like. This one is going to hurt a lot of you. They are stripping away the vast majority of the bonus points that have been available to you guys in the quality category. This is going to have a detrimental effect on a lot of the quality category scoring out there. As of this year, they've gotten rid of the bonus points that you get for additional high priority and outcome measure reporting beyond that first mandatory one. In prior years, you could report additional high priority and outcome measures and get an additional point for each one of those. That is no longer the case this year. They've also done away with the end-to-end electronic reporting bonus. I know a lot of you you were using those end-to-end electronic reporting methods, such as reporting through your EHR. You used to get an additional point for each of the measures that was being added, or that was being reported through end-to-end electronic. That is no longer the case, unfortunately. So I think negating all of these different penalty or these different bonuses is really going to chop into those quality category scores. So it's vital that you're making sure that you are accounting for that and trying to make up those lost bonus points through better quality data, so you don't see a huge drop in those in your quality category score. They've also extended the use of the CMS web interface for an additional year. I suspect this will get punted a few more years as they're looking to transition away from CMS web interface reporting, but you can use it again this year for those larger groups that have used it in the past. This is another great change that was several years in the making. In prior years, CMS was automatically group scoring any claims data that was being submitted, whether you wanted to be scored at the group level or not. They were automatically doing that, and it was causing huge problems where folks were getting penalized at the group level when they didn't even intend to report or to be assessed at that group level. CMS has thankfully finally made this change. We've been kind of clamoring about this one for a few years, trying to get them to put some pressure on them to make this change. Finally, they have made this change for this year. So now they are no longer group scoring the claims quality data unless the group submits another performance category at the group level. So meaning you are submitting group level data for the PI or improvement activities category. If you submit group level data in either of those two categories and are a claims-based reporter for quality, that is what will trigger CMS to calculate a group level score for your quality data. So a great change, long time coming. They've also modified some of the policies for measures with significant changes or errors. Another good change, we were kind of worried about this one. CMS was concerned that they could not use the 2020 performance data to calculate 2022 benchmarks for the quality measures. They have thankfully determined that they did receive enough quality data across the measures in calendar year 2020 to allow them to create benchmarks to be used in 2022. That was a good one. That was going to create this kind of impossible scenario where you would have not been able to really monitor your performance throughout the year and understand how your quality measures are going to score because they weren't going to be using those existing benchmarks. So thankfully that did not finalize. They have established this new policy for minimum scores for the new measures. Remember on the last slide, I mentioned that there were 4 new quality measures. They have also instituted this new policy where the worst you can do on a new measure in its first year is 7 points. So as long as data completeness and the case minimums are met, and there's a benchmark that can be made on that new measure this year, you're going to score between 7 and 10 points. If there is no benchmark created during this performance year on that new measure, you're still going to get 7 points for that measure. So in the second year, that floor is still there, but it's lowered just a little bit to 5 points. So in its second year, the worst you can do on this quality measure is 5 points. And the worst you can do this year if you adopt one of these new measures is 7 points. So that could be a good reason to flip over to using these new measures that are available this year as they try to promote the use of these new measures by dangling a little carrot for you. They have also retained the 3-point floor for the existing measures. They were proposing to get rid of that this year and drop that down to 0. Thankfully, that did not finalize either. So they are maintaining that 3-point floor, but just know that beginning next year, they have already finalized that they are making those changes. So they just delayed their proposed change by a year. So as of next year, you get 1 point for measures without a benchmark instead of 3, and you get 0 points for measures without a benchmark or if data completeness or case minimums are not met. However, if you're one of the small practices, that they will still maintain that 3-point floor for all measures. Improvement activities, performance category updates. They have added 7 new activities to the inventory. They have removed 6 activities and they've modified 15 of them. So again, just like the quality measures, the advice I gave on that slide, if you are intending to reuse improvement activities from one year to the next, make sure that it isn't one of the 6 that were removed, and make sure that your activities were not significantly modified in a way that's going to change how you are implementing them this year as well. They are also trying to focus more heavily on health equity, which is great. I love seeing that they're doing this. Of those 7 new activities, 3 of them have a health equity focus, and of the 15 modified activities, 11 of them have been modified in such a way to address health equity. So great move on CMS's part there as they try to promote more health equity across the health systems. And then new activities have 2 new criteria that must be met, where they're not duplicative, and they must push clinicians beyond the standard clinical practice as well. They've also instituted a new process to suspend activities that may present patient safety concerns or if they're obsolete. Under the PI category, this first one I already mentioned, we have automatic reweighting for the clinical social workers. And also, as I mentioned, the small practices no longer have to apply for that reweighting. They are now included in the automatic reweighting policy for the PI category. This change will throw you guys for a little bit of a loop, I suspect. They did modify the rules around the public health and clinical data exchange measure or objective. In prior years, you could choose to report on any of the 5 measures that are contained within that objective. They have now changed that significantly. They are now requiring you to report on the immunization registry and electronic case reporting measures within that objective, unless exclusions can be claimed for either of them. And remember, in this program, an exclusion claimed on a measure counts as one of your 2. So if you are a non-immunizing provider, you could claim that exclusion, but and then maybe just attest to meeting the requirements for electronic case reporting, and then you would satisfy that objective. If you are able to claim exclusions on both immunization registry and electronic case reporting, you could claim those exclusions and then get away with not reporting any public health registries. You don't lose those points when that happens. Those points roll over to other measures. So you can still get those points. And for this year only, you can exclude from the electronic case reporting if your EHR vendor, your EHR product you're using, is not certified to the standard. To be able to offer e-case reporting within the EHR, each of those vendors has to get certified to be able to do that. Some of the EHRs are not yet certified to that standard. If that is the case for you, that is an automatic exclusion for you. You actually cannot do the e-case reporting if your vendor is not certified. There's a hyperlink there on this slide under the certified EHR technology or CERT word there that will take you to what's called the Chapel website. That is the website CMS has, or actually it's Office of the National Coordinator, or ONC, that calls out all of those certifications. You can drill down into your particular version of your EHR to determine whether your EHR is certified to the e-case reporting standard. They did not modify the Provide Patients Electronic Access to Health Information measure. I am so glad they did not. They didn't do what they were proposing to do. Under the proposed rule, they were going to mandate that all patient records and from January 1st of 2016 on had to be indefinitely available to patients. There was a lot of pushback on CMS, as you can imagine, on this proposal, such that CMS realized it was just not technologically or financially feasible to mandate that. So thankfully that didn't go through. Pay attention to this one though. There's a new requirement to complete one of the safety assurance factors for EHR resilience, or SAFER guides. There's several of these SAFER guides available. There's a hyperlink there. The one that is now mandated that when you are reporting your PI measures, you're going to have to attest that you have conducted a self-assessment using the High Priority Practices Guide. And again, I have the hyperlink to that guide there on your slide. So as I look at this, it really almost looks a little bit like an additional SRA. A lot of the questions they're asking you in the High Priority Practices Guide kind of sound very similar. They're very, very close to some of those questions that you're answering in your annual SRA. So take a look at that. Make sure that you are conducting that self-assessment this year so that you can attest to having done so. Although I will say that, as I understand it, there aren't any penalties. So if you get to that stage and you say no, we didn't conduct that, I am told that will allow you to still continue. That won't kick you out of the PI category. That's probably short-lived. CMS typically puts these new regulations in place, but there isn't a penalty to start with. I can all but guarantee there will be a penalty in the future. But as of this year, my understanding is that if you do not attest to conducting that, it will still allow you to continue, and you won't be penalized. But better to be safe and just get it done this year. And they did modify the Prevention of Information Blocking attestation statement to align with the 21st Century Cures Act. So when you get to that point and you attest to those statements in this year's reporting, you will see some changes there in the wording that align to the new 21st Century Cures Act. Cost performance category. They have added 5 new episode-based cost measures this year. We haven't seen any additions for a year or two, but they've now added 5 new ones for us. There's 2 procedural measures that are melanoma resection and colon and rectal resection. Under acute inpatient, there's a new sepsis cost measure, and under chronic conditions, there is a new diabetes measure and an asthma or COPD measure. They have also, they really want everybody's help now as of this year in developing new cost measures. So in prior years, the development was limited to CMS contractors. That is now expanded for this year. They're really trying to get all stakeholders involved in the development of these new cost measures. We're kind of nearing the end here in these updates. I have one big update to tell you is that unfortunately, the free technical assistance, what's called the QPP SIRS program, that is what has funded Altarum and our amazing partners that have been supporting clinicians across the Midwest for several years now since this program started way back in 2017. Unfortunately, we are a week away from that funding ending. So as of right now, as of 2/15, Altarum is not going to be available to you, and nor are any of our amazing partners that have been that a lot of you connect with as well are no longer going to be available to you. You are going to get support, to get questions answered as of 2/16, as of Wednesday of next week. You are left with the Quality Payment Program Service Center. The number is on your screen there under the technical support column. That said, we're still here for another week. So please use us while we are still available to you as that free technical assistance resource. Our website is still live, the qppresourcecenter.org. If you can still join us and work with us. You've got a week to pummel us with all the questions you could possibly throw at us to make sure that you have everything you need before our funding dries up. I will say, however, that it's looking promising that there will be an extension to our funding. Just last week, through a lot of advocacy efforts, there is a new bill in Congress that has been introduced to extend this funding. As you know, the wheels of change move very slowly, and that is especially true within Congress. So we do not expect that new bill to be signed off on or approved in the near future, but we are very hoping that it does get signed and there is an extension. If that happens, what that would likely mean is we're going to go away for a period of time. So you won't be able to get to us until that new funding is in place and all of that kind of restarts the whole QPP SIRS network that has been built over the past 6 years. So it pains me to have this go away. I know that we know that you guys still need us, and we really want to continue to help you. We are very hopeful that we'll get this extension. There's been a lot of work being done at Altarum to get that extension in place. So good news that there is a new bill that is being introduced just last week into Congress. With any luck, that gets approved, and we get that additional funding that would allow us to restart this engine. But as of right now, you've got us for another week. Connect with us at the QPP Resource Center. I know a lot of you are still working on your 2021 reporting. Still, the MIPS is still available to you guys to kind of look at that data and make sure it's clean. It is what you think it's going to be before you submit it onto CMS. So through that QPP Resource Center, you can get to MIPS as a small practice for free. And I would highly encourage you to use this sandbox to kind of understand your data, make sure it's exactly what you think it's going to be before you pass it on to CMS this year. And you still have till March 31st to get your 2021 data submitted. So that said, with Altarum kind of going away, in terms of QPP support, we are very much not going away in total. We've got a bunch of different programs. Altarum does a lot of different stuff in the QI space, quality improvement space. We've got 3 options for you here to still stay connected with Altarum. We've got the Healthy Hearts for Michigan program that is still recruiting rural primary care clinicians across Michigan to provide no-cost assistance and tools to help your patients suffering with cardiovascular disease. If you're interested in learning more, click the link on your screen. I'm actually the project manager on that project. I would love to talk to you about your practice joining the Healthy Hearts for Michigan program. We also have the Michigan Sustained Patient-Centered Alcohol-Related Care, or MySpark program, that supports primary care practices in Michigan to address unhealthy alcohol use by integrating alcohol screenings, preventative advice, and evidence-based treatment options into clinical workflow. Great program there. And then we also have the Reframing Optimal Management of Pain and Opioids in Older Adults, otherwise known as ROMPO. That project is a comprehensive educational program helping providers respond to the unique challenges faced when caring for older adults who have pain. So 3 great programs there that we have that you can use to stay connected with Altarum. If you're interested in any of those, please grab the slides, click on the link to learn more, which will get you connected to the right folks over here at Altarum to join those programs as well. So with that, I'm going to open things up for questions. I don't see a lot of questions in the box right now. I've got one comment from Jeanette. Let's see. Yeah, so Jeanette says, this is painful. 75 points and all bonuses gone. What is the quickest way to find the new measures on the QPP site and other changes to IA, etc.? If you go into the resource library, is probably one of the best places to grab those new inventories. CMS typically calls out a lot of those changes in there. If you also navigate to the quality section of the QPP website and the IA section of the QPP website, that will also kind of help you understand those categories for this year as well. And again, you can always ping us for the next week anyway, and we'd be happy to kind of help you through some of those changes as well. But you're right, Janet. It's painful. We've been warning everybody that minimum performance threshold was going to skyrocket this year, and it did. We were also surprised by the removal of those bonus points. However, we didn't see that coming as of yet, and we know that is a significant challenge. A lot of you are kind of padding your quality category with those bonus points, and with those bonus points gone, a lot of you are going to lose 10, 12 points in those categories by losing the end-to-end electronic bonus, as well as those additional points for high priority and outcome measures. So, we typically see some folks getting 10 extra points or so added to that quality category. And so it's going to have a pretty detrimental effect on quality category scores this year. Hopefully, because you're addressing it this early in the year, you can, maybe, hopefully, make up those losses through better performance on those quality measures, or maybe switching to other quality measures that might be performing better than they have in prior years. Or I just urge you to take a look at that and make sure that you can account for and compensate for that significant loss in those bonus points. But you're right, Jeanette. It's painful. With that, folks, we are still here for questions for the next week. So you've got my email and my office phone number there on the screen. You've got the QPP Resource Center. We've got our QPP Info website that is manned by my awesome team of colleagues that you can pummel with questions for the next week as well. Hopefully, it is just a short period of time that we are offline and not available to you. If and when we get our funding that allows us to restart our QPP support, we will certainly reach out to all of you and let you know that we're back online and available to you again. In the meantime, thank you so much for, some of you have attended many webinars with me, and it's been great to see you guys come back over and over again over these 6 years. It's been hundreds of webinars over those 6 years. It feels like it's kind of bittersweet for this being kind of my last one out of this string of hundreds of webinars over 6 years. I look forward to seeing you on future broadcasts. Hopefully, those broadcasts are related to the QPP Resource Center again and the MIPS program. But as I mentioned, Altarum is here for a lot of other QI support as well, and I would urge you to take a look at what we have to offer. With that, thank you so much. I hope you have a great rest of your day, and I hope to see you again soon.